About 38% of U.S. adults are considered obese and are at risk of developing conditions like heart disease. The World Health Organization listed physical inactivity and unhealthy diets as a major risk factor to diabetes, cancer, and heart disease. That was in its Global Threats report this year. But obesity is more complex than calories and exercise. Those who know the disease best are working to change the perception of possible solutions.
I'm going to share my story, my journey, as I live it, with whoever will listen.
Jeanine Sherman's first thinking on weight loss surgery was similar to a common perception.
It's the easy way out, the easy way out. That's what you hear the most.
A last resort.
And I thought, really? Bariatric surgery? Am I to that point?
At 5'5", around 230 pounds, Sherman's primary doctor told her that she was a candidate when she asked about weight loss medication. At the time, Jeanine had a very high BMI, but no other weight-related health issues. For 3 years, she researched thinking she could avoid surgery.
If I copied this lifestyle, if I tried to live the lifestyle of a bariatric patient, and I learned from being in these groups their daily eating habits, their exercise habits, well, then I can maybe lose the weight and not have bariatric surgery.
After gaining 30 more pounds, Sherman decided surgery was best.
I can tell anybody that I talk to that that day is one of the top 10 days of my life.
Maintaining her weight now at around 143 pounds, Sherman found her voice through the hashtag I'm a bariatric patient.
Many patients were ashamed to talk about the surgery and didn't want to share that they had surgery with friends or family.
If you stigmatize someone because of their weight, they're going to gain weight. They're not going to lose it.
The Obesity Action Coalition tries to break the stigma with support.
One way to deal with stigma is actually to share the experiences that you faced and try to take away that self-blame.
The group's president says they created a place online called Weight of the World. People share their experiences of living with obesity.
I believe sharing my story really helped me.
There has been progress in breaking stigma since obesity was recognized as a disease.
And we've seen a lot of companies now starting to invest in whether it's behavioral, medical, or surgical treatments for obesity.
The FDA approved a new weight loss device for obesity this year, and United Healthcare was first to drop what doctors called an unnecessary requirement of bariatric surgery, 6 months on a medically supervised weight loss program. But until access and perception improve, even more people like Sherman need to be heard.
We can make a difference for those patients when it comes to stigma 5-10 years from now.
And tomorrow we'll talk about a new guide for doctors to help them address patients' weight concerns with compassion and without bias.